everyone. Yeah, once again, welcome to Health Issues with Dr. P. This is our complete episode on this series on prostate cancer. And we are going to be looking at the commonly asked questions on prostate cancer. Commonly asked questions. What are these questions that people commonly ask about prostate cancer? Okay, the number one question people ask about prostate cancer is, what is PSA? I hear about PSA. I hear about ultrasound scan for the prostate. What does it really imply? But a lot of people miss something to PSA means prostate-specific antigen, and it's a test we usually do to help us monitor how the prostate is behaving. If your PSA is high, what should be done is for you to have what we call a biopsy, prostate needle biopsy, preferably your ultrasound-guided prostate needle biopsy. So that is what should be done if your PSA is high. Some people ask questions. I did a scan and they said that my prostate is enlarged. Does it mean I now have prostate cancer? The answer is no. The prostate is enlarged does not mean that you have prostate cancer. The prostate being enlarged could just mean that that you have an ordinarily enlarged prostate, particularly if you're having symptoms. If you're not having symptoms of the ordinary enlarged prostate, you don't really need to bother. Some people also ask questions like, I'm going to have an endoscopic prostate surgery, TOP, transradiation of prostate, laser prostate surgeries and all that. Is that curative for prostate cancer? The answer is no. Those things, transradiation of the prostate, bipolar inflation of the prostate, hormone laser inflation of the prostate, tubing laser inflation of the prostate, transradial vaporization of the prostate, these are all procedures that are done for the ordinarily enlarged prostate, and it does not offer cure for prostate cancer. If you have prostate cancer, what you do is actually different. Radical prostatectomy, either the keyhole or the open radical prostatectomy. Those ones are the surgeries, radiotherapy, and all the rest of them. So, for TRP, bipolar inflation, and all the rest of them, laser procedures, these are all for the ordinarily enlarged prostate and does not offer any form of cure for prostate cancer. If you have prostate cancer and you're having obstruction and you're finding it difficult to do, you can do what we call channel transradiation of prostate for you to remove the prostate that is blocking that channel through which you pass so that you can be urinating freely. But that you're not urinating freely does not mean that you've been cured of prostate cancer. The treatment for the prostate cancer is a different ball game altogether. Another question people tend to ask is, will prostate biopsy lead to a spread in my prostate cancer? The answer to that question is no. Prostate needle biopsy does not lead to the spread of prostate cancer. Rather, it helps us to be sure we make a diagnosis of prostate cancer and then provide solutions for you. So if your PSA is high, the next thing to do is to do a biopsy. So biopsy does not lead to the spread of prostate cancer. I say it the often time, prostate needle biopsy does not lead to a spread of prostate cancer. And it's a necessary thing that needs to be done if we are suspecting that you have prostate cancer. So what I'm looking to ask questions like, if my PSA is high, does that mean that I have prostate cancer? No. That your PSA is high does not mean that you have prostate cancer. Because of course there are some other things, infections or some other things could lead to a rise in the PSA. A high PSA does not automatically translate to prostate cancer. That is why we say, if you have a high PSA, let us do a biopsy to be sure that there's prostate cancer or not. That is actually what to do when you're suspecting that somebody has got prostate cancer. So some other people to ask, the drugs that they give for prostate cancer, are they curative for prostate cancer? Most times drugs that they will give, like anti-androgens, drugs like retrovirgin hormone analogs, these are drugs for late prostate cancer. They cannot be curative for prostate cancer. And some begin to ask, okay, I have prostate cancer and they remove my testes. Does that mean that I've been cured of prostate cancer? Removal of the testes does not cure prostate cancer. Removal of the testes can only help late prostate cancer to limit the spread, to delay the progression of the prostate cancer. Remember, the issue there is that testes produces a hormone called testosterone, which fuels prostate cancer. Prostate is a different organ altogether. Testis is a different organ altogether. When you are removing the testes, you are trying to starve the prostate of the hormone that fuels its growth, which is also the same thing that certain medications like the Zoladex, the glandular-reducing hormone, and also Leuprolide and all the rest of them play. So removal of testes is not a cure for prostate cancer. It's only a form of palliative care we offer for people with third, stage 3 or stage 4 prostate cancer. So this is a very important episode. Very important episode. Do well to share this particular video. You have my YouTube page, Dr. P. Inform other men about this particular series on prostate cancer. This is the final episode of this particular series. So we had 6 other episodes on this series. And if you have prostate cancer, or you're a woman, you have a husband that has prostate cancer, or even people you don't even have prostate cancer, for every man, it's very important that you watch this episode so that you can be well informed. Information is power. Thank you very much for following us through these episodes on prostate cancer. Thank you.
Dr. Paul Ngwu is a urologic surgeon who is passionate about sharing his rich knowledge to improve your understanding of medical procedures and optimal health. With years of experience from intricate laser surgery techniques to essential endoscopic procedures, prostate health guidance, gynecological care, men's health, and etc., Dr. Paul's YouTube channel covers a vast range of medical enlightenment. By watching our tutorials, you'll gain in-depth understanding of medical procedures, insights into the latest technologies and techniques in use, confidence in your healthcare decisions, access to expert advice from a trusted specialist. Enhance your knowledge today by subscribing to this YouTube channel, Dr. P.E. Ngwu. Hit the subscribe button now. Join our community of healthcare professionals and individuals to learn more. Be accurate with the latest in medical knowledge. Click the notification bell to stay updated on our new tutorials, as page access is completely free. Dr. Paul Ngwu, empowering your medical knowledge one tutorial at a time.